Okay, good afternoon, everyone. I recognize many familiar names, but for those of you whom I have not met, my name is Arash Asher, and I am the Director of Cancer Rehabilitation and Survivorship at Cedars Sinai. I'd like to welcome you. Thank you for joining our Wellness, Resilience, and Survivorship seminar series. For those of you who might be new to this series, we started this a few years ago during the pandemic. We really started this as a way to bring topics that we think are important and highly relevant to our community, to our cancer survivorship community. In the past, we've covered a variety of topics from experience of awe and what that has to do with survivorship to the power of music and healing. We had a spirited debate on keto versus plant-based diets and the like. So today, we're really excited to have a discussion about the promise and the uncertainties of psychedelics. So by way of background, I don't need to tell you, our community who has experienced a cancer diagnosis at some point, that at least at some point during this journey, the experience of distress had to be highly prevalent and obvious to our shared experience. And I know some in our community has faced a difficult diagnosis with a difficult prognosis. Others may have completed all their treatment, but may need to contend with a fear of recurrence or uncertainties about the future. And we'll discuss this, but in my mind, at least as I see it, it's almost as if we require some kind of metamorphosis within ourselves if we're going to contend with these profound existential and spiritual challenges. It's almost as if, we need a change in consciousness, a change in the way that we see the world and the eyes in which we see the world if we're going to manage these concerns. And really the question for today is whether psychedelic-assisted therapy can be one of the options to help us in this space. And with that said, I feel incredibly grateful to have what I think is an all-star panel. So how this is going to work today is I'm going to briefly introduce our panelists, and I won't give them all the credit that they deserve, but I'm going to keep it relatively short so we can save our time for the meat of the content today. And then each of our panelists will give a presentation, and then we're going to really try to save some time for discussion and questions towards the end of the hour. And I'll make sure to finish at 3 p.m. Pacific to be respectful to everyone here. So first off, I am extremely honored to introduce Dr. Anthony Bassis. He is a clinical psychologist, a clinical assistant professor of psychiatry at NYU, adjunct professor of religious studies at the University of Ottawa. For nearly 20 years, he's been conducting FDA-approved clinical research with the psychedelic compound psilocybin. I know he's going to talk about this. He was the director of palliative care research on a trial that demonstrated a significant reduction in distress from a single psilocybin session in persons with cancer. He's also the study director and lead therapist on a trial investigating a psilocybin-generated mystical experience upon religious leaders. Dr. Bassis has authored numerous publications on psychedelics and palliative care, spirituality, and end-of-life existential distress. He maintains a private psychotherapy and consulting practice in New York City. Dr. Bassis, thank you so much for joining us. Next, I'd like to introduce Anne Hamilton. She is the founder and executive director of the Survivorship Collective, which is a nonprofit that advances education and patient advocacy around mental health and psychedelic-assisted therapies for cancer patients, survivors, and co-survivors. As she'll talk about, she survived advanced stage breast cancer as a young adult, and after that, she became an advocate for the cancer community. She is a certified mediator, holds a JD from Yale Law School, a master's degree in philosophy from Stanford University, and is a graduate of Notre Dame and the American Film Institute. And I should add, she has really been the catalyst for bringing us all together. And so, Anne, thank you for spearheading this and for being with us this afternoon.
Thanks. Thanks so much. Happy to be here.
Next, Dr. Kendall Maxwell is one of our own. She's the neuropsychologist for the acute service line, as well as the Center for ALS Care at Cedars Sinai Medical Center. She is the author of two internationally known podcasts, including the 21-Day Positive Mindfulness Meditation Challenge that has over 1 million downloads, and is the author of a guided journal called 12 Months to Happier Habits. Dr. Maxwell is in the process of building the study design protocol for a phase 2 clinical trial related to using psilocybin-assisted treatment for distress among individuals with ALS specifically. She continues to also provide psychotherapy via her private practice, specializing in existential therapy and cognitive behavioral therapy. Dr. Maxwell, thank you again for joining.
Thank you for having me.
And last, and certainly not least, Ziva Dashi is a licensed psychotherapist in private practice based in Los Angeles. She has over a decade of clinical experience in medical settings in New York and Los Angeles. Ziva is board certified in psycho-oncology, is trained in oncology-focused cognitive behavioral therapy and psychodynamic therapy, and specializes in health psychology, women's health, and psychological recovery and growth post-cancer treatment. I should mention she was a valued member of our team at Cedars Sinai before she went on to her private practice. Ziva, thank you so much for joining us. Okay, so with those introductions in mind, we're going to start this afternoon with a presentation from Dr. Bassis, and then we'll kind of continue the conversation from there. Again, Tony, thank you so much for joining us. I'm going to be in the background to help moderate, and I'm going to hand it off to you.
Great. Thank you so much, Dr. Asher and Anne, for inviting me to this series. Quick note, we're about to start a new study. What I'm about to talk about today, psilocybin with people with cancer and other disorders in palliative care, and I'll be certain to send that information to Anne and Dr. Asher. We'll have two sites two UCLA sites are participating, one at Westwood campus and one at Harbor. So I will send you that information. It's great to be here, everyone. I'm going to speak for about 15 minutes. It's a very brief presentation for a very large topic. I will skim the surface a bit, hopefully communicate the heart of it, and look forward to in our Q&A segment to really kind of even flesh out more of the content and questions people may have. My quick background, and Dr. Asher said this already, I've been doing this work for about 20 years now with psychedelics. Before that, I was working with people with cancer. And as everyone here knows, contending with cancer or any illness that is life-threatening does unspeakable harm, can do unspeakable anxiety and just trauma to the person and the families and the community. I've been very heartened and I'm very encouraged by the results we're seeing in clinical research that's FDA approved, looking at psychedelics, and we'll talk about that in a moment, to help alleviate the often intense emotional, existential, spiritual distress that people with advanced illness or at the end of life may experience. And I'm very encouraged, although it's still preliminary, we're in clinical trials. These aren't legally available yet in terms of the drug I'm going to speak about today, where we're excited about the future. So with that, many people in the audience may be seeing some of the press out there about psychedelics, and there's been a lot. And I think it could be confusing for people to really navigate what are they and what is the history. I recall something about the 1960s, so we want to be a bit clear about all of that. Psychedelics is a very broad topic. Some psychedelics, which by definition briefly are compounds that when humans take them could produce profound changes in consciousness and thought and perception and thinking, and at their best can provide possibly these meaning-making experiences. Some of them have been around for thousands of years and are found in nature, like we'll talk about today, psilocybin, which is found in a certain species of mushrooms. Some were man-made in laboratories like LSD. So these four you see here are very common what we call classic psychedelics, psilocybin, LSD, DMT, and mescaline. People may also be reading about MDMA or ketamine in the newspapers. We could discuss that a bit later, but the one I'm going to focus on today is the one that we've been working with in these clinical trials. So for the past 15 or 20 years, there have been a number of trials that the FDA, the government, has approved to investigate how one dose, maybe two doses, two experiences with psilocybin, this active agent in many species of mushrooms, people know the word magic mushroom possibly, how that might be able to help those who are suffering with emotional distress because of a life-threatening illness. Importantly, they're not to treat the disease itself. There's no known reason why this would treat cancer itself, although we could talk a little bit later about how by treating the emotional side of ourselves, we may also be able to hopefully help our healing, but that's a different conversation. The main objective is to help alleviate that often profound existential distress of living with a disease like cancer. Psilocybin has been around for thousands of years. We know it's been part of indigenous cultures. The ancient Aztecs used it in rituals. I won't go into the neuroscience in a too significant way, but we know it involves the neurochemical serotonin. They're not addicting medicines, so unlike a lot of other drugs that will trigger kind of a reward system to want more, psychedelics don't show that kind of activity, which is important. And again, this goes back many years. You see an example here of the Mayan culture at 1000 BC. They used mushrooms, and here's some mushroom stones as part of a ritual, as part of healing. And that's different from the current mythos of the 60s, whereas maybe just recreational. This was about healing, and that's how we're talking about it today within this healing culture or container. So back to that more in a few minutes, but I want to just briefly review something you all know. A cancer diagnosis or contending with an end-of-life illness is profoundly impactful on a person's life. We know that anxiety and depression and a host of forms of psychosocial suffering are much higher in people with cancer and other illnesses. And also, I should point out that we have a paucity of ways to treat that anxiety. We have medications like antidepressants, anti-anxiety agents, and we'll speak more about that in a few minutes. We have psychotherapy, but there's a paucity of approaches to really address that angst, that form of suffering when the end of life might be rising because of an illness. And as a healthcare profession, we're really trying to increase the tools we have to treat people with that particular sense of suffering. I personally think this psychotherapy with psychedelics may be that kind of tool, and hopefully we're a few years away from knowing much more about it in terms of availability. I think that slide's not working, but okay. Anyway, I was going to discuss something called demoralization. We all know what depression is. We know what anxiety is. There's something called demoralization that we're seeing a lot of in cancer patients and in palliative care patients. It's distinct from depression, and it's really at its heart a profound existential distress, a lack of meaning. And we know that demoralization syndrome, which is not being shown on the screen, I'm not sure what happened, can be a contributor to depression and hopelessness, and even the desire for a hastened death in people with cancer. Oh, now it's there. So, and that's what I was discussing. So it's a sense of profound hopelessness, meaninglessness, and emotional and existential distress. And I'm going to show you in a few minutes how psilocybin therapy has been shown to, so far in clinical trials, really reduce this sense of emotional suffering. I love this study. It's not about psychedelics at all, but it's about what are the important things at the end of someone's life or was coping with cancer that have been shown to be important from the patient's perspective and of the physicians. And the two most important constructs or items are meaning and transcendence. This need for personal meaning making in life, not just with illness, is profoundly important for how we cope with life, and of course with illness. And the sense of transcending whatever it is this consciousness, the sense of a transcendent self has been linked with optimal health. And it's kind of a way of setting the table for psychedelics. Psychedelic compounds at their heart alter consciousness, often through a transcendent state of awareness, which we'll talk about in a second, and at their best provide a meaning-making experience. What is meaningful in our life? I'm sure most of you, if not all of you, know the great Viktor Frankl. He was a Holocaust survivor. He wrote a book I recommend everyone know and read, Man's Search for Meaning. And this, in many ways, is how I see our work, that these experiences with psychedelics can provide meaning. Viktor Frankl once said, meaning can be found in life up to the last moment, the last breath, even in the face of death. And meaning and spirituality in coping with cancer and other end-of-life disorders is profoundly helpful. And that spiritual well-being and meaning-making are often buffers against this significant emotional distress. And again, Viktor Frankl, one of my heroes, but I love this quote from him. Man, or let's upgrade that, humans are not destroyed by suffering. We're destroyed by suffering without meaning. So I want to discuss briefly now some of the research. I'm not going to get too wonky and scientific about it all, but we've now had a number of trials looking at one dose, one experience with psilocybin, and I'll show you how that works in a moment, with people with cancer, some with advanced cancer, and many who have since passed away. There's been a few major studies. The two most largest ones were at NYU, where I work, and at Johns Hopkins. Another one at UCLA many years prior. That was kind of the foundational trial. Our results, and let me fast go to this, is that in this one session with psilocybin, and I'm going to, again, let you know how that works in a second, we found these results. There was an immediate and sustained reduction in depression, anxiety, again, demoralization, hard to treat. We have no known treatment for demoralization in healthcare or in psychiatry, and a sense of hopelessness. We also found an improvement in existential well-being, quality of life. Up to 90% of the participants felt an improvement in their quality of life living with cancer. They felt it personally meaningful and significant. And which is remarkable, and we'll talk about today as well, is these benefits, these promising results were mostly linked with people who had this very positive, what we call a mystical experience. Sounds a bit woo-woo, but Abraham Maslow called it a peak experience. It's this sense of this transcendent state, how we can find meaning in those few hours of an altered state. Psilocybin, by its nature, when taken in a proper set and setting with proper guidance and safety restrictions, can often promote about 6 hours of being in an altered state of consciousness, 3 of them at a very intense level. And in that state of awareness, so often, again, when prepared in a certain way, and we'll talk more about this in the Q&A section, I'm sure, people can find a way to cultivate insight and have profound experiences, sometimes described as existential, in facing and coping their cancer and maybe with the end of life. A few quotes from people in our trial. Many of these people have since passed away. Many are still around. One person wrote, "This changed my life." This is regarding their participation in the psilocybin trial. One person wrote, "I can't imagine it," referring to her fear of cancer. "I felt a constant state of becoming. I felt gratitude like never before in my life. I felt totally welcome." Death doesn't matter. My person who actually was about a year away from her death. We can speak more about that later. Less afraid of death. Death is part of life. There's one person on trial who was in remission, but she was paralyzed with fear of a recurrence. And that fear was really not allowing her to live a functional life. She had a very profound experience in the trial. And she wrote that she has no fear of recurrence. It doesn't enter her mind. And she went on to, it's still around, and I know her well, do really, really well. And the depression was decreased dramatically. One person wrote, I experience with the feeling that one is eternal, that all of existence happens in every moment. What we hear a lot about, and we may hear more about today in our conversations with each other, people talk about love, and I'm a scientist, but I've grown very comfortable speaking about this part of our trial. People often speak about love, a loving kindness towards self, even in the midst of suffering, a loving kindness towards others in their life, and even forgiveness for past transgressions people may have done, and forgiving oneself. And people speak of a larger love, kind of this something larger in our life or in the world or universe that feels very important, and it's very poignant to see this in all the results we have. So, briefly, how is this research done? So, one, people are very carefully medically and psychiatrically screened. So, there are some exclusion criteria we could talk more about later, but people are selected where this hopefully wouldn't be a problem for them, or there's no contraindications with the medications they're on, or their psychological status. There's a preparation period. Two therapists or monitors spend time with the person, preparing them for what it's like to be on psilocybin, the psychedelic compound. While we can't predict what will happen in their experience, we can help them cultivate a sense of how to go through the altered state. That they'll be safe. We'll be there monitoring their blood pressure and things like that. But to go into it with a sense of openness, to go into it with a sense of allowing whatever's coming up in consciousness, which could be very dramatic and sometimes scary, to greet it, to meet it with an openness, and to hopefully learn from these experiences that could occur in their mind during this few-hour experience. Cultivating an intention is important. Of course, the intention of these trials is for people to cope better, to live with the uncertainty of cancer, or if it means the uncertainty and anxiety about approaching the end of life if the cancer is advanced. Then there's this all-day medication session where they spend a full day in a very safe setting. I'll show you a picture of the room in a moment. And then after their session, after this experience in this altered state of consciousness where they're encouraged to move into and accept and be with the unfolding changes that could be joyful, that could be somewhat frightful at times. There's weeks of integration or helping them understand what happened and supporting their experience. Quickly, this mystical experience I spoke about, a few key features. One is unity. People often talk about during their experience a sense of all things being connected, all people and things, a very profound human experience. A sense of this is it wasn't a drug effect. In all my years doing this, it's very rare for someone to say, well, that was good or bad or indifferent, but it was a side effect of a drug. The way people speak about this is that was real. That was part of consciousness. That's more real than this reality. And if there's one takeaway people come away with today, is that these experiences, while psychedelics can generate it, they're not just about the psychedelics. We're wired for meaning. Human beings have these experiences in other ways too. We have it in everyday life. We have it in prayer, meditation, spontaneously, and at the foundations of religion. We have them in a host of ways. Maybe not 6 hours worth, but this capacity to access some transcendent part of who we are, something profoundly meaningful. So we're wired for meaning. Humans are wired for these experiences. It turns out these compounds can generate that experience in a safe setting when done the proper way. They're also very frightening. They can be. They can be profoundly positive, but because of these altered states, and people have heard about the so-called bad trip, we work with people to help understand even the dark moments in the experiences. And even through these dark moments, we could learn. And then finally, this is of transcending, self as we know it, transcending time and space. People will talk about it's like pulling the lens back on experience and finding themselves in a much larger kind of panoramic field. That's a gift for the person who's might be in advanced cancer and whose body might be ceasing to function soon. The idea that the insight that I'm more than my cancer. I'm not just my cancer. I'm not just this body. There's something more profound about what is the self or what I am. I'm going to go really quickly through. By the way, this mystical experience again has been linked with these better outcomes than our patients, although all the experience that they have with psilocybin have been very beneficial and insightful, even if at times very complicated and difficult. Real quick, I want to get to this. That's the room where we did the studies. It was a comfortable room, although it's in a hospital setting. It looks like a comfortable living room. The person's lying on the couch and has the medicine. We have them wear headphones and eye shades. Headphones play about 6 hours of comfortable music. That's all in the spirit of encouraging them to go within to the experience and be with the changes in consciousness. They can, of course, always at any point sit up and take the eye shades off, but we could think more about that later. Real quick, folks, just some of the results. If you can see these two lines here, there's a pink line, which is the group who took psilocybin, and the blue line is the group who took a placebo, a non-active drug that was not the psychedelic. In one of the clinical trials, we see that immediately, there's a red vertical line, once they took the drug, within the first 7 weeks, we see this dramatic reduction in anxiety and depression. Right here, this is the psilocybin group, and this is the placebo group. Another study, another measure, same thing. Depression, dramatic reduction. These are numbers, folks, we don't see typically in psychotherapy research. These are very significant and dramatic reductions, and they were sustained for 7 weeks through the course of the trial. And at 4.5 years later, we revisited some of these surviving patients and found the results still there. Depression, this is important. I'm going to finish in a minute. Demoralization, hopelessness also reduced greatly. The pink bar is psilocybin group. The blue bar is the placebo. This is 4.5 years later. Again, we see the survivors, many had since passed away. Again, their anxiety and depression at this 4.5 year marker, if you can see that quickly, was still reduced. So it's remarkable that we see this. Again, we're in clinical trials, but they're promising results. And again, the demoralization was reduced as well. And last slide, people often ask me, so what does psychedelics do? What is this about? As you can imagine, this is a very big and complicated conversation. I do think maybe in one simple way, the way I experience it with these patients, is it helps us recalibrate our relationship to suffering. It's a paradigm shift in healthcare potentially. The medicines we all take, everyone's on something. And for mental health, antidepressants, while helpful, they work by taking them every day to reduce the symptom. This medicine, psychedelic therapy, is taken once. It's an entire way of rethinking how we heal. And by moving into the suffering, into the experience, people are finding ways to find, ideally, transformation, insight, and healing, not by reducing the symptom only, but by the cause. What is the nature of that suffering? And I think of that Rumi quote, that the wound, the suffering is the place where the light enters you. By moving into even the most difficult spaces, we could find insight. And these experiences and consciousness generated by psychedelics can, so far in our clinical trials, seem to do that. Let me stop there. I look forward to the Q&A, and I'll stop my screen share.
Thank you so much, Dr. Bassis. And that was a extraordinary set of images I didn't realize the drop in depression, anxiety, and demoralization and whatnot that's been reported. So that was a great, useful background, and now I think will provide us with maybe a more personal and human face to what this might mean on an individual level. And floor is yours.
Thank you. It's a pleasure to be here. And thank you, Dr. Bassis, for that presentation. I also just want to thank Cedars for hosting this. It's so wonderful to have this be the context that people are learning about psilocybin in. I'm also an attorney as well as the founder of a nonprofit, so I don't encourage anybody to participate in illegal activity. My hope is that this is a step in the direction of making this safe and legal, and this is the right kind of forum to do it in. So I want to just start with that. I'm a storyteller by nature, so I'm going to tell a couple stories, and I'm going to share some slides as well to start off. So let's see, and let's see there. And we'll just play. Okay, so you guys can all see that, right? Yeah, so that's me. That's me 6 years ago. I was diagnosed with advanced stage breast cancer in my early 30s. I'm also an attorney and the founder of the Survivorship Collective. But most importantly, I think of myself, I mean, cancer doesn't define me, but it certainly is the most profound and meaningful experience and frightening experience that's ever happened to me. And it's changed my life dramatically. So I'm going to tell a story that you guys are pretty familiar with. Once upon a time, you're just going about your life, you're worrying about getting to your job on time, getting a promotion, how to pay the rent. And then a diagnosis comes and changes everything. And you're suddenly pulled down this dark rabbit hole. And when I think about cancer and the diagnosis and treatment for that first year, I think about falling down this rabbit hole where I lost so many different things. I lost my health, I lost my career, I lost my romantic relationship and also a couple of friendships. I lost my breasts and my ovaries. I lost the ability to take part in recreational activities I really enjoyed. I certainly lost confidence in the future. I lost fertility, lost hormones, lost sex for a while, really sad. We can talk about that later, maybe. I certainly lost a part of my identity and mental health. And there's other things as well that a lot of us lose as we're falling down that rabbit hole of diagnosis and treatment. But after treatment, you're suddenly in this different world and you're sort of let out into the wilds. But that world's really different than the one you imagined. And I think about this as sort of an Alice in Wonderland deal where everything is different, but nobody's told me how to manage it, right? And often, this is my experience, often the battle is just beginning when you're finishing treatment. And there are a lot of different monsters that come up. This is just one statistic that really hit me when I read it. So young cancer survivors are 57% more likely to develop depression, 29% more likely to develop anxiety, 56% more likely to develop psychotic disorders in the years following treatment compared to siblings or healthy members of control group. Those numbers are pretty frightening. And I think of there being probably like at least 4 major Jabberwockies that people deal with in the years after a cancer diagnosis. There's medical trauma, there's fear of recurrence, there's fear of death. They're related, but they're a little bit different in my mind. And the number one that I had the most trouble with was fear of resubscribing back into life afterwards. And psilocybin really helped me deal with these monsters. I'm going to tell you some personal stories about that in just a second. But most importantly, if you're dealing with that, you're not alone. This is the website for our nonprofit, and you can check out what we do. I'm going to stop sharing here. And great. So, yeah. So I'm going to talk about the first Jabberwocky just briefly, which is medical trauma. So after cancer, I remember going on a date, like as soon as my hair grew back, I went on a date. And I remember like a couple dates in, the person touched me and I just froze. And I didn't understand why. And then, a while later, the first time I was having sex afterwards, it was as though I was watching myself from the ceiling. I was so disassociated from my body that it created this really unpleasant experience when I was trying to be intimate. And I began to realize that, while I'm so grateful for all of the amazing doctors who've helped me, the process of treatment involved a lot of very painful ways of touching and inserting things into my body. There was obviously chemotherapy and radiation burns, removing my breasts. It's kind of violent when you think about what that is on a psychological level. All the needles that were inserted to me were very painful. I remember these really nice radiation techs who were cute men, moving me around on the radiation table when I was naked, and I didn't know their names. It was this very intimate thing that happened over and over, and I didn't know their names. And what I ended up doing was I ended up disassociating from my body as a way of coping. I'd consented to these things. Obviously, I wanted to live, but looking back, I consented because I was afraid I was going to die. And that's a very complicated way of thinking about consent. So there was this medical trauma I was dealing with. That's the first Jabberwocky. The second Jabberwocky was this fear of death. I remember I was in the emergency room with an infection, and I ended up being in the hospital for, I don't know, about a week. And it was pretty bad. And my mom at one point asked me what I wanted to have done with my body if it didn't go well, right? And I remember really picturing myself decaying underground. And there was this really visceral image of it. And that image stayed with me after years after I recovered. So there's that fear of death and what that actually means. And afterwards, I would like look at my dog and picture that happening to my dog, and look at my sister and picture that happening to my sister. So it was sort of this recurring image of what would actually happen. And then there was this fear of recurrence, which I'm sure a lot of you are very familiar with. But every time there was a scan, every time there was an ache in my back, or I had a headache, I thought maybe it's coming back. And it would sort of creep up at these times when I really could have, been enjoying my life, and it would sort of stop me in my tracks, and not just ruin a day, like ruin a week, ruin more than a week. And therapy for me wasn't really helping. It wasn't getting at those core issues, because these are really existential issues. And I was put in touch. I'm not going to go into detail how I was put in touch, but I was put in touch with somebody who was a guide, and I had my first psilocybin experience, and I've had two experiences, and they were years apart. So I'll describe the first experience very briefly. During the experience, I hallucinated at one point that I was dying. And I remember looking at my arm and seeing it turn from a young woman's hands to an old woman's hands with arthritis, and then age spots, and it started to decay. And then this flesh started to fall off my arm, and then the bones disintegrated, and I died, and I must have screamed. And the guide who was sitting next to me, she was like, "No, what do you see?" Because I didn't want to look at it. She's like, "What do you see? Look at it." And I said, I'm an old woman, and I'm dying, and I'm dead." And she said, "Well, how does it make you feel?" And I said, "Well, it's actually kind of comforting to think of myself as an old woman dying." And death in that moment didn't feel scary at all. It felt very peaceful. And afterwards, I remembered, just repeating like, "Oh, I get to be an old woman. I never thought I would get to be an old woman. Death isn't scary anymore." And days after, weeks after, I was just not afraid of dying. That's weird to say, but I wasn't. I was sort of at peace with it. And also, I was able to sort of get back into my body, because I was able to grieve everything that had happened to my body in that session as well. I remember just like crying and saying like, "I don't want anything bad to happen to my body. I love my body." And I had sort of stopped loving my body because I had to let people do things to it. And it just really helped me get through that portion very quickly. And it persisted for years later, like years later. And I'm still not really afraid of death. So those are the two, those are the first two stories. The second story, or the third story, the last story is, so a couple of years later, I was doing fine, like cool with death, not really, but I'm fine. But I was dating, and I realized that, I was living a life that was kind of small. I think my attitude at the time was, I'm doing fine. My life is good, but it's not gonna come back. I'm not afraid of it coming back, but if it comes back, I don't want people to be relying on me. I felt very responsible for being reliable and for being a good bet. And I remember on a date saying like, "Hey, you can date me. We're gonna have a great time, but I'm not a great bet for the future. Don't like want things from me." And I was okay with that until I reached my 5-year anniversary of my mastectomy, and I went on this like diving trip to Cabo, and there was this like wreck that we went to. We went down, and there was beautiful fish. And I remember seeing that all the fish started to hide. They started to sort of go into these like the crevices and hide. And then we turned this corner, the dive guide and I, and we saw this giant bull shark, and which obviously not very good. And we went back around because we wanted to get back up to the boat. And it turns out there were a lot of bull sharks that just came up while we were investigating the wreck, and they were above us. So we had to stay put for a little while. And as we were staying put, one of them got really curious and kept coming up to us and coming up to me. And I remember looking at it and thinking like, "Oh, whatever you want to do, it's cool. Like I'm at peace with that." And it was with curiosity and appreciation of the beauty of the moment and the animal, which was really great at the time. But then when I went back up to the boat, and I survived, I still have my arm. I remembered thinking, wow, like that's not exactly how I want to be living my life. Like I've been living my life in a way where I don't have anything to lose, right? And that's a waste of a life. And so my second experience was a way of dealing with that. Like, how do I resubscribe into life so that I'm invested and I want to be upset if I die? And so that was the second experience. And that was a very personal one in the Redwoods near this retreat center. And during that experience, I was able to, what I took away from it was there's a distance between what breaks my heart and what breaks my spirit. And I want my heart to be broken a million times in this lifetime, but it doesn't have to break my spirit. And that really allowed me to think about having children. I actually went to the gift shop and bought a onesie at the retreat center, which I have and I plan to use. So really, really great experiences. And also ones that I think, were intentional and spread apart long enough where I could really go in with an intention. Like I needed to solve a problem that I kept bumping up against and wasn't able to solve and by normal means, I would say. So those are the stories I wanted to share. The takeaways I think are that, death is both a medical and a spiritual experience. And so we need to have therapies that really address both simultaneously. And psilocybin, because it's a mystical experience, is really good at getting at that sort of connection. The second one is it didn't do the work for me. Like psilocybin didn't solve my problems. It just allowed me the space to actually look at them. I was able to look at my death, accept it, feel it, and then move on with that understanding. So instead of, trying to cover up the feelings of anxiety, I was able to look at them and incorporate them into my life that it was in a healthy way. And it's a great tool. Like it's not the only tool we have, but it got me to a place very quickly that I think it would have taken years to get to otherwise. So those are the stories I wanted to share today. The Survivorship Collective is a nonprofit. It's founded by and for cancer survivors. And our goal is to make psilocybin and other kinds of psychedelics safe and legal. And we're following in the footsteps of veterans so that we can provide it in ways that are responsible and legal and safe. And that's all I wanted to say. Thanks so much.
And thank you so much. That was very honest and very important for us to hear. So I really appreciate your insights, your very intimate portrait. Thank you so much. So we have 10 minutes, so I'll open it up to any questions in the chat. And I see there are a couple already, but while we're waiting, and I know Anne alluded to this, but if I may just start, and maybe this will be for Dr. Bossis or maybe others in the group. As a clinician, when should we be thinking about, okay, so we need this change of consciousness, this change in perspective to overcome, let's say, the fear of recurrence, for example. When do we want to lean into religious experiences, spiritual experiences, mindfulness, yoga, anything in that space versus saying, let's come to psilocybin? I know it's not an either or, but how do you think about that? How do we think about these non-pharmacologic options as part of the menu and deciding who's a good candidate for what?
Sure. I mean, briefly, I encourage those other modalities all the time. I mean, I think meditation, spirituality, other ways of coping with this kind of suffering should always be entertained if that's what the person's interest lies in. These experiences with high dose psychedelics and our clinical trials, in so many ways, do mirror that mystical experience we could find in spirituality, but mindfulness, meditation, are incredibly coping ways for anyone. I also want to be clear as well, again, that what I'm talking about is a high dose of a psychedelic, only available on a clinical trial through the FDA, through the government. It is not legal, the work that we're doing yet, and the way we do it. And again, there can be very intense emotional experiences people can have. And we also rule out for these medical exclusionary criteria with various, there's some cardiac possibilities. So that's how I'm presenting this, not with all due respect for the speakers, not in the underground. And it's this high dose model therapy, not microdosing. But yeah, all those other modalities are incredibly important for anybody suffering with an illness.
There's another question from the chat from Dr. Vansko-Mosher. So any research on the anxiety and depression with aging? So we've been focused in the oncology space. What about in the geriatric population?
There are no trials yet. I mean, the trials were still in the infancy. So the only trials that we're doing is with, in this kind of conversation, is people with palliative care or cancer. There were studies with depression, alcoholism, but there's been no studies with healthy people, just who are aging.
Okay, thank you. A few other questions coming through. So what about someone that may have PTSD specifically from their cancer experience and cancer-related trauma? Any research specifically for PTSD and psilocybin?
Taking all the questions. Many people, of course, are traumatized by the diagnosis itself, and of course by the experience. Our studies so far are treating people with depression or anxiety in the context of cancer or end of life distress. Not looking at PTSD specifically, there's a whole different body of research with something called MDMA that addresses PTSD and veterans and people who have gone through assault, but not the trauma of cancer. But of course, the people we're seeing clearly may have traumatic experiences within their cancer journey, and we're seeing that. But when I'm measuring PTSD per se.
Okay, and again, this is another one for you, Dr. Bassis, but the issue comes up about drug interactions, particularly with antidepressants. Are there drug interactions we should be wary of, particularly with anti-anxiety medicines or SSRIs or other antidepressant medications?
So again, there are contraindications. We're trying to learn more about them as we go along. Until now, we've excluded people who are on SSRIs, certain SSRIs. There is thinking that could be a problem because they're both serotonergically mediated, that there could be some adverse effects that would not be great at all. So we're slowly beginning to look at that. Could we entertain some SSRI along with the psilocybin, and that's now being studied. But again, these are in clinical trials, and there are serious consequences, and would recommend people on their own try to figure out what medication they should be taking or not taking. In trials, people are looked at carefully, and until now, people have been taken off their SSRIs. But we're looking at that now. Can we see people with a low level of SSRI? And we'll know more, but we're still in kind of the early stages of all this.
And I can speak to how to find out about clinical trials, if you don't mind. Berkeley's, the psychedelic research that Berkeley does they have a list of clinical trials, and our website links to that as well. So if you want to take a look at that, you can. I also know Sunstone Therapies I believe they have 2 clinical trials available right now for cancer patients. And I know, Tony, you might be having a clinical trial coming up soon that might have sites in California as well. Is that correct?
Yes, and actually at Sunstone. So our study's going to have 5 sites, one at Sunstone in Baltimore and Maryland. 2 UCLA sites, one at Harbor, and one at the Westwood campus, and then there's one in Marin County. And so, yes, we'll probably begin that maybe in the next 2 or 3 months, and I will certainly send you a link to and the requirements for that is that the patient would have to be in the palliative care setting at those locations. But if someone is being treated at those locations, this study would be available to them, and that's we're excited to start that in a few months.
So
yes, and I believe. Oh, go ahead.
I was going to say, is there a resource we can give now so they can stay in touch for those clinical trials that are opening? What website would that be?
Well, the best website for anybody, and of course you all know this, is clinicaltrials.gov. So clinicaltrials, one word, .gov. It's really easy to use, a really easy interface, and it's a government site with all the trials that go on in America. And if you put in very quickly the search item, so psilocybin or a psychedelic, cancer or some illness, you'll get all the trials in America that are currently addressing that. So that's probably the best kind of one place. I will let you know when our study begins, of course. But yeah, it's confusing to the public. Where are the studies? Where is this happening? What's legal? What's not? And in terms of, again, the psilocybin at these, the way we do it, it's not legally available. Probably at least 3 years away from it being available as a prescription. There's a different conversation about states legalizing it on their own, but we're talking about the federal rescheduling of this drug for medicinal purposes. We're still a couple of years away from that, at
Yeah,
least.
and also, yeah, thank you. And also, so there are organizations for veterans. Heroic Hearts is one of them, and they have special retreats for cancer patients or cancer survivors who are also veterans and their families. And one of the things our nonprofit is doing is we are following in the footsteps of veterans groups that have been sending people to places where it is legal, often working with indigenous tribes. And that's the model that we hope to follow. So if you want to learn more about that, you can also go to our website.
Okay, I realize we're at the hour. I want to thank all of our participants who joined. I really want to thank our panelists. I know you gave generously of your time for preparing and joining for this important discussion. Thank you all so much. I learned a lot, and I think our community did as well. So thank you all so much for joining. We hope to see you for the next seminar, probably in a couple months.
Bye.